A number of years ago, we set out to design a better, safer ambulance. Traditional ambulance for 40 years or more have had a bench seat in this position. Attendants worked in the back without any restraints, getting up to reach things that they needed, reaching across the patient to reach the monitor. We felt that there had to be a better way to design an ambulance where the attendant could remain seat-belted in a seat that allowed him to do what he needed to do: reach and treat the patient, reach the cardiac monitor, reach the medications. Most of what he needs to do en route to the hospital can be done while restrained. So we came up with this workstation concept. The seat is a track seat. You can move the seat fore and aft if you need to reach the lower part of the stretcher, upper part of the stretcher, and it can face forward, allowing the paramedic to reach the monitor, supplies in the drawer. Another nice feature of being seated in this position is total access to this screen. This screen controls the lighting and climate control functions and fan speeds for exhaust fan in the back of the ambulance. The screen is duplicated on the other side of the ambulance depending on where the paramedic happens to be seated. A few of the features that I'd like to discuss in the cab have to do with both the ride, navigation, and technology. We have big screens here for our navigation. Navigation information gets pushed directly to the screen by dispatch so we can map to our call. Another important thing that we have on board for the patient's comfort is called liquid spring suspension. We have a control panel. With the control panel, we're able to adjust the ride of the ambulance to 3 different comfort settings, making the ride extremely smooth for patients who may have injuries and may be susceptible to bumping and jarring. Along with those features, the ambulance is high-tech in that it carries its own onboard computer. The computer is used for onboard navigation, plus all of our charting is electronic and done on Toughbooks. So the computer has become a very important part of our ambulance work. Here in the back of the ambulance, I'll demonstrate how we load and unload patients. First of all, by opening the doors, the back end of the vehicle will automatically drop to make loading and unloading easier for the paramedics. Step folds up to get out of the way. And not like the olden days when you had to lift the stretcher out, we have a system that unloads the patient for you. Stretcher comes out. As soon as the stretcher comes out, we deploy the legs. Once the legs are deployed, unlock the stretcher, and now we can wheel into the house or wheel into the ER, depending on whether we're picking up or unloading a patient. So I hope this little tour helps you understand a little bit more about our ambulances, how complex they are, and why they carry the price tag that they do. And the ambulance department would sincerely like to thank the foundation for making this part of their fundraising campaign to help us provide both a safer environment for our employees and for our patients.